Okay.
All right, Dr. Darj, you told us all about missing teeth, and you did enlighten us that having missing teeth is not a good thing because we can get a caved in, dried out, aged look. We can get headaches, and all those type of stuff. So what are some of the major methods to replace a missing tooth? And has there been any advancement over the last decade or two or something like that? Computer had lots of advancement. Did dentistry have advancement there too in terms of replacing teeth?
Absolutely. The best method, given the right criteria being present, the best method to replace a missing tooth is an implant. An implant is a fake root that we implant in the bone. We create a root for the tooth, and then we place a crown over it. The next the other methods are either a fixed bridge or a removable bridge. Either one of those would do the job. The best one is implants, but any of those would work.
Okay. Now, give me some idea here. Let's talk about the fixed bridge, since that's pretty much what most people for sure strive to. I guess a removable bridge, it really usually temporarily, and if all finances fail completely, but let's talk a fixed bridge, which has been around for a long time. Why is it not as good as an implant? Shadel, tell us, when is a fixed bridge better, and maybe the cons, when is a fixed bridge not so good versus an implant? Give us the big picture of it.
Okay. Now we're going to talk about averages. On the average, a fixed bridge would last about anywhere from 5 to 15 years. An implant is lasts longer and it's healthier. A crown, which
what are we talking about? Measurable, significantly longer on an average. I get that.
On an average, an implant should last forever. But that's
significantly longer.
That's significant, yes. And that's not to say every implant does, and that's not to say every bridge fails, but on average, implants last much, much, much longer than bridges.
And why is that?
Because a bridge counts on 2 teeth as anchors to restore that missing tooth area. Now, you're essentially putting the forces that is required for 3 teeth on 2 teeth. So there is this micro movement, and there is this micro rocking that occurs, and it essentially causes damage to the adjacent teeth. Mm-hmm. Plus, keeping it clean is very difficult. Most patients don't know how to clean under it. Most educated patients don't know how to clean under it and around it. It becomes cumbersome, and that contributes partially, I believe, to why they don't last as long.
Right. I've heard that. In fact, whether it is knowing or not knowing, I'm sure most people know, because once they do get a bridge, I'm sure the dentist explains it very thorough, right?
Right.
But let's take a guy like me. I'm a little bit on the sloppy side, I think. So my wife tells me, when we go to the bathroom at night together, which we do literally for 20 some years, or almost all the time, and I have finished showering, brushing, shaving, she's still brushing. You know what I mean? I do all those things. She's still doing her teeth. So now if I now have a bridge and have to take that thread and put it underneath, how often will I say, not tonight, let's do it tomorrow? And by doing so, what you're saying, I will probably accumulate a gum disease much more. And of course, the gum disease rattles the flesh, rattles the bone, and it all has to fall apart. Never mind losing the bridge, but it probably also is very damaging to the rest of the body, right?
Yes, absolutely.
So
gum disease is an inflammatory process. It causes a lot of other problems. It's linked to heart disease, loss of memory, shorter lifespan. It's connected to a whole array of diseases.
Right, and you have mentioned that in another video where we talked very specifically about it.
Right.
So we know that never mind losing the crown and the bridge, which replacing it is difficult. And once it is broken, you probably now need to replace both of those teeth again, right? I mean, so that the two teeth where it was anchored on it. So now you have to make this thing called a bridge even bigger probably, and need to ruin a couple more teeth, shave them down, grind them down, and put it on it.
Right, but at that point, once the bridge fails, most likely we end up with a removable bridge, because a fixed bridge can only go a certain width. Beyond that, you can't do it. It's like having a bridge from here, I don't know, from New Jersey to New York. You have to have a calculated distance. Beyond that distance, the bridge is going to fail.
So beyond 3 teeth, 4 maybe, it becomes rather difficult. So if you had 3 already and they fail, now you need to go to 5, that becomes rather difficult. So at that point, a person has a removable bridge, uncomfortable and not so nice and all that stuff, or he goes back to implants and basically re-spends the money he could have done before anyway, right?
Absolutely. It takes longer. The chance of success is less, and it costs more. It causes a lot of hassles down the line.
So do most people these days easily go and say, yeah, I want the newest technology, and if an implant is it, I'll go for an implant? Or do they still go for the bridge type of thing?
Most of our patients, after I've had a chance to talk to them and make them understand, they do choose implants because there's really no comparison.
Got it. And let me ask you, if a person needs one implant because one tooth is missing, or he takes a 3-unit bridge, that's the only way he can do it, because you need to shave 2 down, hang the bridge on it, have 3. So he needs like 3 ceramic crowns, so to say, versus one implant with a crown on it. Is the price difference really very much?
Not very much, actually, not very much at all.
Right. So maybe you pay a little bit more, but have a twice as long a lifespan, and less risk of gum disease. You still, of course, need to clean your gums and floss and brush, like if you have normal teeth or whatever. That's not unavoidable, right?
Yes.
But it's not as cumbersome. You're not opening the door to more easy gum disease than that. So
absolutely.
Yeah. Well, all right. Wonderful.
Not only that, Helmut, you wouldn't, if we go the implant route from the get-go, we wouldn't have to shave down those 2 teeth, those 2 adjacent teeth. It's best to have your tooth and with its own original enamel, because enamel is the strongest biological material.
Right. So anyway, you don't have to ruin 2 good things in the first place,
right?
And you're totally you're fine, and you can last longer. Absolutely great. And the material you're using for an implant, this metal stick, the metal screw you're putting in, it's titanium, the same they use in hip replacements and stuff like that.
Yes, it's the same material that we use in hip replacements and knee replacements and all kinds of other things.
So it seems to be a type of material the body takes very well and doesn't have any adverse reactions to it.
Absolutely, yes. It's been done for decades.
Beautiful. So would you call an implant an improvement in technology, kind of like computers improved us from the yellow pad a little bit? Even though most of us still using a yellow pad too.
Yes. It's absolutely an improvement, and it's a disservice not to offer that to patients. So as a first choice, we offer that, and only if we couldn't convince a patient or it wasn't feasible to do implants, we'll go with a fixed or removable bridge.
All right. Thank you very much.